Welcome to Cooper University Healthcare. We are dedicated to providing the same extraordinary care for patients with intellectual and developmental disabilities as we do for all our patients. We understand that providing care for this patient population may require extra steps and coordination, and we're here to help. To support families, caregivers, and hospital staff in preparing for IDD patient visits, Cooper has a team of IDD clinical navigators. We understand that some patients may exhibit more challenging behavior, so if it's helpful, we can have specially trained security staff stay with you during your visit to provide support. Our main goal is to be fully prepared for your arrival, making your visit as successful as it can be.
A clinical navigator will contact you 7 days before a non-surgical appointment or 3 days prior to a surgical appointment. During that call, we will ask you if you have any requests for accommodations for your visit and create or validate the care coordination note in the patient's chart. This information is vital because it helps us tailor our approach to meet the specific needs of each patient. For example, during a recent visit, an IDD patient who preferred to be called a name that was not their first name was experiencing claustrophobia. As the staff tried to calm the patient, they were calling them by their non-preferred name. This simple oversight added to the patient's anxiety and illustrates why it is essential to communicate preferences and needs in advance, no matter how small those details may seem. Having those details in the patient's care coordination note can help staff be prepared to provide the best patient experience. Each patient is unique, and we fully understand the necessity of making accommodations for patients with IDD. Here are a few examples of what we can take. We can schedule multiple procedures in one visit to minimize disruptions. If fasting is required, we can arrange for the patient to be the first case of the day. Some patients may struggle with parking garages or elevators, and if that's the case, we can schedule your visit at a location with open parking lots to avoid these triggering aspects. Many times, patients with increased sensory sensitivities do not like to remove their shoes. So for certain procedures, we can make accommodations to keep shoes on to help ensure their comfort. On the day of your visit, please remember to bring comfort items that can help ease any anxiety for the patient. Upon arrival, call us to let us know that you've arrived. At that point, we can confirm that the patient's room is ready before you transition from the car to the building. To reduce the number of transitions, patients will bypass waiting areas and be taken directly to their room upon entry to the hospital or clinical space. Rest assured that patients will always be in a private room and will not be placed in the hallway. Bedside support from licensed clinical social workers and the IDD team will be available during your visit. We understand the unpredictable nature of caring for individuals with IDD, and if the day of your visit proves to be challenging, we can assist you in rescheduling that appointment.
Families and caregivers of patients with IDD who choose Cooper will receive the same extraordinary care as all other patients who come to the hospital. In addition, you will receive special planning and considerations to help ensure a successful visit. After your visit, family members and caregivers will receive a follow-up survey. We genuinely want to know how we did and appreciate your feedback on how we can improve our services even further. Thank you for choosing Cooper. We look forward to supporting you and your loved ones in every step of your care journey.